Hi, I'm Jonathan Baillie and I edit Health Estate Journal, the HEJ magazine, and I'm here this afternoon on the second afternoon of Healthcare Estates 2024, which has been a busy show, with Maz Daoud, who's Head of Fire Safety at NHS England and has very kindly agreed to spend 10 or 15 minutes talking about his role and some of the current issues for him. So Maz, can you tell me a bit about your own background first of all? I know you were a London firefighter, I believe, at one stage.
Yes, I joined the London Fire Brigade many years ago now, and I was started off as a firefighter and then progressed through the ranks, and then went into the fire safety section where I was fire safety inspecting officer and then team leader, and then I became a station commander. I was station commander at Heathrow for a couple of years, and then for a while I was group commander in charge of fire safety for the north of London. And subsequent to that, I worked for a couple of London trusts as their fire safety advisor.
Which were those?
They were Croydon and St George's.
Yep. So big South London.
Big South London Trust, yes, as the fire safety advisor to those, which was invaluable in learning about fire safety actually in hospitals rather than the theory of it. So I'd witnessed it from the enforcement side, witnessed it from the doing side, shall we say. And then for 6 years I worked for Sodexo as their authorising engineer for fire, which did include hospitals, but across their whole range of places that they covered, which was probably hospitals for maybe 20 or 25% of that. And then just over 3 years ago I started working for NHS England as their head of fire safety.
So how wide a remit do you have in terms of types of facilities, etc., for fire safety?
Pretty much any NHS facility that's in England is covered under it. The main part of my job, I guess, is writing the guidance, or part of it is writing the guidance that is followed in the forms of the Health Technical Memorandum, HTMs, and there is a suite of those called Fire Code, and we have in the last 12 months revised three of those documents, and are in the process of revising further documents as well.
And which are the areas that you've covered most recently in the revisions?
The most recent one was on fire risk assessments, so it's HTM 0503 Part K, and we've made some quite considerable changes in that, it's a legal requirement to complete a fire risk assessment on a workplace, and hospitals are workplaces. So it's a legal requirement. There is guidance issued by the British Standard, and what we've done is brought our in-house guidance, as in NHS England in-house guidance, in line with that of the British standards. But we've expanded on it and adapted it to fit the very unique environment that is a hospital, because they are unique amongst just about everywhere else. As an example, if you think of a fire alarm in an office building, the fire alarm goes off, it issues a sounder, and everyone goes and waits outside. You can't do that in a hospital; it simply wouldn't work. So the systems are completely different and are very, very specialised for hospitals. And the only thing that perhaps comes anywhere near would be something like, I don't know, an airport.
Where there are very large numbers of people, some of whom have limited mobility.
Yes, indeed.
Yeah. And you've got all sorts of ages and demographics of people to move around,
yes,
and evacuate if necessary.
And obviously in an airport as well, if you've got people airside, you don't want to move them out of airside. You've got very strict security issues as well.
Sure.
So that's a unique environment, and hospitals are a unique environment as well.
So do you spend quite a lot of your time now at acute and other hospital sites?
Not as much as I'd like to. I'd like to spend more time, but I do tend to go and look at specific aspects now, especially where there are issues around which direction the fire safety is to go. One of the things we've looked at in rewriting or revising Part K on fire risk assessments is deciding what is the appropriate level of safety within a building. So that's defined in government guidance as you need to reduce the risk to as low as reasonably practicable. So where is as low as reasonably practicable? And that's quite a difficult decision to make. And it is the point at which, or it's defined at the point at which the benefits are considerably outweighed by the financial implications of that as well.
Presumably the Building Safety Act coming into force must have had quite an impact on thinking on fire safety, and I gather there are suggestions that the restriction or the ramifications on height and stipulations for height on buildings may be changed. I think that's possible.
It is. I mean, the Building Safety Act specifically covers high-risk buildings, and high-risk are defined as hospitals that have a storey height of more than 18 metres. In a block of flats, a typical storey height would be 3 metres. In a hospital, it's 4 metres. So you actually don't get many stories in height in a hospital before you reach that criteria of 18 metres. And hospitals tend to be quite sprawling buildings as well. And often if they're built on a sloping site, the height is measured from the lowest point. And that can easily meet that 18 metre threshold. It has presented us with a lot of opportunities actually, because it raises the image of fire safety in hospitals generally. It brings in the fire safety regulator now as effectively as not the enforcing authority, but instead of going to building control if you're doing any work, you now need to go to the building safety regulator if it meets the height criteria. That takes longer, but it means that trusts are having to think a lot more about fire safety when they're doing any proposed works or building new hospitals as well. The standards are not any different, but the way one goes about putting in the applications and the detail that's required is different.
Has it presented a big challenge to lots of estates teams in terms of thinking, do you think? And I guess it depends on how much resource they're able to devote to an area which is clearly critical from a safety point of view.
Yes, it has. I don't know that it's made it more difficult for Estates Department, but it certainly changed the way that you need to regard fire safety. It's not, I don't think it ever was an add-on, but it certainly becomes intrinsic now. You have to consider it at the very early stages, and you have to document any decisions that have been reached. You have to write them down in electronic format. The building safety regulator needs a lot of information before they'll approve the going ahead with the scheme. Whereas before, with previous regimes, it wasn't so well thought through beforehand in many cases.
So are you finding your workloads increasing in terms of the range of tasks you have to undertake and your responsibilities now?
Yes, the workload is increasing. A lot more questions are coming back. So you've written this in the HTM. What does it really mean in reality on the ground? A question I had last week was slightly different. Was one of the documents we've written is on fire safety training, and it covers fire extinguisher training. Do staff need to be to complete fire extinguisher training? And we've included a reasonable section on that. And I've got questions on, well, what does that actually mean when it's enforced in the ground? Do all staff need to do fire extinguisher training? Is it specialised staff? Which staff? And it's very much down to each trust to make that decision on the basis of their training needs analysis. And it may well vary from one trust to another. However, it should be, again, it's something that needs to be considered. It needs to be written down and a decision made as to who requires that training, and then obviously you need to put systems in place to make sure that it's delivered.
Do you think that it's likely there will be changes to the Building Safety Act on the far side as to what constitute the buildings covered in healthcare?
That's an interesting question. I really don't know where it's going to go in terms of the will of any governments to extend it further. What I think will happen is once trusts get used to implementing the new regime for higher risk buildings, so those that meet the height criteria, I suspect that what they'll do is apply the same standards throughout the whole of the estate. So
which I guess would be a good thing.
Yeah, it'll be basically the trickle-down technology that you see in a lot of racing cars in everyday cars. It will be the same.
Analogous to that.
Analogous to that, yes.
What about PFI and the implications with handback? Is that going to present quite a challenge to some trusts over things like compartmentation and standard and structure of buildings that they're getting back effectively?
Yes, well, it's something that is being thought about anyway,
Yeah.
and there are contractual requirements anyway. So written into the contract is the level of standard that's applicable when
The buildings are handed back.
buildings are handed back. So that's already there. I don't think the Building Safety Act will make really any difference to that, but certainly it is an important consideration.
What about work that you've done with IHEM on the fire safety side? Can you touch on that a bit, please, Maz?
Yes. It's been very interesting working with IHEM. So we've set up a fire safety technical platform that's been going for about 6 years now, so a reasonable period of time. We have produced our own guidance notes, which anyone can find on the IHEM website under fire safety technical platform. They have been referenced in the NHS HCM series as well, so as in a good way to go when you're looking at, certainly maintenance is the main thing that we've covered, and that's maintenance of fire compartmentation, which is one thing that you mentioned earlier, fire dampers, fire doors, and those, and we certainly will be adding more to that. So I think IHEM has done really well to put those documents out there, and they've been out for about 3 years now, I think, and have really set the standard that's required in a very complex environment.
Given that some of the recent high-profile incidents with fires, has it really refocused minds in the NHS generally, do you think? Or, I mean, probably across the board, really?
Yes, it definitely has. Fire is always high profile because there are inevitably fires, not so much in hospitals. In fact, the incidence in fires in hospitals is
Are they decreasing?
well, looking at the number of fires actually spread further than the room of origin, it's very, very small in hospitals. We don't get extensive fire spread. And that's down to things like, as you said, the compartmentation you mentioned earlier.
Yeah, and presumably effective fire safety policies as well.
Effective fire safety policies
and staff
and
knowing what
management.
they should do.
And that's the critical one. The fire safety training is absolutely critical, and that's one of the reasons why we didn't have a previous HTM specifically on fire training, but that was issued about 3 months ago. So now we have specific guidance just on training that sets out the level of training that we expect from staff.
And presumably different levels of staff, etc. Yeah.
Yes. So that's what needs to go into the training needs analysis. What staff need to do, what training, and to what level as well.
Do you think, I mean, it's a critical area, do you think sort of budgetary constraints can prevent, hospitals and trusts training as many people as they should? Is that not necessarily the challenge? Is it just it needs more focus?
Budgets are always important. So on the one hand, we need to make sure that our training meets legal requirements. That's not optional, and it is a legal requirement to provide training. It's a legal requirement to do drills where necessary as well. So we've included that in the HTM on training. You have to do it, it's not optional. But it needs to be done to a high standard, and the high standard, it's not just a case of repeating the same old thing. It's a case of people knowing. And the one thing that we've included in there is that it's incumbent on the fire safety manager to ensure that he or she has a system to make to know that the staff that have been through the training have are actually now capable of doing the tasks that they need to do when it comes to fire safety. So it's not just a case of sitting online on a computer and going through a course, or sitting in the classroom and going through a course. It's a case of being trained and then using that training maybe in an exercise or drill so that it's refined, because you don't really know how it's going to work in reality unless you actually try that out. So it's then doing that part of it and then the fire safety manager ensuring that the staff are able to do it to the appropriate standard.
So I guess while you wouldn't endorse individual companies, you'd applaud some of the software companies that have produced software to ensure that various levels of staff are trained regularly and to flag up when they're not being. I know there have been a number of systems like that available for some years, which I guess are a big aid, particularly in a large trust.
I think the one thing that the HTM on training has said is that there are other methods of training which may be equally as suitable as face-to-face. It does say that there are a few areas where face-to-face may be the only way to go at the moment, but even that perhaps is being challenged with things like virtual reality, and some of these training systems are immersive and you actually learn a lot from them. So it does allow new methods of training, but at the same time it's very much outcomes based. It relies on that feedback loop, so making sure people know what they need to do and ensuring that's tested. It also emphasises working with emergency planning officers within a trust, because they're the ones often that are responsible for any exercises, so it's a case of working together with them.
Thank you very much, Maz. That's very interesting to talk to you.
Okay.